Coming to the adherence of medications in diabetes is an important challenge for present day doctors. So even though there is various groups of drugs and the very effective and the good medications are available in present days, so the adherence of the continued medical education, the medicines in diabetes is really a challenging one. The, in India, less than 30% have a good control of diabetes because of the good adherence to the diet and doctor's advice. So in this respect, you will have to have some of the important tips to the patients. They have to fix the timing and they can avoid the number of doses by adding the drugs or combining the pills and taking at the same time the number of pills at a time so that they don't forget or don't avoid the dose. And again, they will have to have regular reminder so that at the same time of every day and without fail they will have to take the drugs. And in spite of their busy schedule or when they are even traveling, you have to have the reminders so that they can carry the drugs and they can take the drugs without avoiding the dose or without missing the dose, so that their diabetes will be under good control and they will prevent the diabetic complications. Diabetes and how to prevent its complications. So, diabetic complications can well be prevented by doing following measures. So, to keep the diabetes in good control, that is HbA1c less than 7, and lifestyle modifications like diet, exercise, and regular stress control measures. So this will, and diet and regular medical examinations to prevent the end organ damages. So plays an important role in preventing the various complications associated with diabetes. The women and diabetes mellitus. So women have increased risk of cardiovascular disease and other morbidity due to diabetes mellitus. They have 5 times increased risk of cardiovascular disease if they have diabetes, and the risk equals to men, even though they are in premenopausal period in women due to diabetes. So diabetes has important risk factor, especially in women. Coming to the important disease, the diabetes, and its role in various aspects of the disease. So, coming to the topic of family and diabetes, even though family history influences the onset of diabetes, the environmental and dietary factors and stress plays an important role in the onset of diabetes and the progression of the disease and its complications. Coming to the lifestyle modification to control and to postpone the onset of diabetes mellitus. So, even though the persons who have family history of diabetes, by modifying their lifestyle, they can postpone or to some extent prevent the onset of diabetes in them. So the lifestyle modifications are diet that is rich in proteins and fibers and less in carbohydrates, and regular physical exercise to maintain the ideal body weight, and to avoid the fat rich and lipid rich diet so as to prevent the complications of diabetes. Then they have to do the avoid the stressful activity, and they have to do yoga meditations to prevent the onset or to postpone the occurrence of diabetes.